We start with the session 2. Albert Einstein said the only source of knowledge is experience. Hence, by sharing experience, we increase knowledge, and that's what we intend to do here with 3 eminent speakers sharing their experience on digital adoption. Welcome to the session 2, Global Experiences of Digital Adoption. We have 2 chairpersons for this session. First, I would like to introduce Mr. Amit Mookim, Managing Director, IQVIA South Asia. Amit has been a management consultant turned into a business leader and currently oversees the India operations at IQVIA. His experience in digital health has extended to supporting innovation and entrepreneurship in India. An advisor to the NHA on innovation, president at Indus Entrepreneurs Mumbai, and mentor to health startups. As a young bright partner, Amit worked extensively towards growth of his earlier firm KPMG, spreading its base across 11 countries. Those who don't know, Amit is an amateur marathon runner and also coaches entrepreneurs on managing stress while being centered in spirituality. Welcome. Our second chairperson is Dr. Anil Chillimuntha. He's the Vice President of Meta's Group of Adventist Hospitals and has a vast experience of more than 2 decades in healthcare and has been serving as NABH assessor since last 12 years. Also the Vice President of Surat Hospital Association, member of Action Committee for COVID Management for South Gujarat, and Professor and Head Department of Business Administration, Surat, an alumnus of IMA Ahmedabad and Manipal University, with many publishing books, research articles, both in national and international journals. Our third speaker for the day is Professor Min Huei. He is the Chief Data Officer, Taipei Medical University, and Director, Department of Medical Informatics, Ministry of Health and Welfare, Taiwan, since March 2011. An author and co-author of more than 70 papers and articles in international conferences and scientific journals focusing on health data, health information technology, e-health, EMR, hospital information management, and patient safety. I welcome you all, and now I hand over the session to the chair to take it ahead.
Thank you, Bhavisha, and a very good afternoon, good morning, good evening to all our global audience. And first of all, on behalf of IQVIA as well as my co-chair, Dr. Anil, who I'll hand over very quickly, thank you for having us on this panel. And thank you to the panelists from across the world who will give us a perspective. I mean, we have not only someone who represents the country that has been rated the #1 in healthcare, which is Taiwan. And I'm sure that it's going to be a very, very exciting panel, especially given the dynamic situation and time that we are in, where we don't even know 3 months down the line what would be some of the dynamics in the healthcare ecosystem. And hence, this panel is very, very timely.
We know that today we have the digital health, which is moving at a gradual pace, especially in our country like India. But if you look at other countries, they are at a very advanced stage of moving towards digital health. And we know that even though various industries have taken the leap forward much faster and they are much ahead, the healthcare industry is moving at a smaller pace when it comes to even the world across. But there are a few countries which have processed themselves, which have equipped themselves and moved very innovatively to adopt digital health. And one of the countries is Taiwan. And I would like to request Professor Su, if you could kindly tell us what is the experience of digital health adoption in your country, that is Taiwan. Professor Su.
Yes, thank you for having me. Actually, in Taiwan, we have 23 million population. So relatively, we have actually a small scale of people. So actually, I want to share some our experience about how to improve access to healthcare by digital transformation, especially during the pandemic. And if you ask the question, who led the digital transformation of your company, I believe most of us would agree that it's not the CEO, not the CTO, it's not any CXO, it's the COVID-19 virus during the pandemic. And in Taiwan, fortunately, we contained the pandemic quite successfully until at least May. This May, we have the first outbreak of the pandemic. And fortunately, we can then contain the first wave of outbreak within 3 months. Recently, we have only single digit new cases or zero new cases every day. And the accumulated cases in Taiwan is only around 16,000. And the death cases is around hundreds. Actually, is the data today. And actually, we rely on the robust national health insurance infrastructure, because here we operate a single payer system, very similar to the NHS system in the UK. So all 23 million people are covered by a single system. And we issue health smart card to our people, and when they visit their doctors, they go to hospital, they use their smart card. And actually, hospital will just upload all the health data to National Health Insurance Administration on daily basis. It's not a real time, it's still a batch based, but the lag actually is quite limited. And actually, we also release all the health data to researchers. So that's why actually around 10 Taiwanese go to the court and file a lawsuit against the government about how come government had the right, of course, after the identification, release the data to researcher. But fortunately, since we have this system, actually, our citizen, no matter which hospital or clinic they visit, they go to there to receive a PCR test or rapid antigen test or get their vaccination. Actually, the second day, they can have access to those records through their app, through their mobile phone. So it's quite robust. And we check the so-called TOCC history. T stands for travel history, occupation, contact history, and the cluster by using the health data system. Actually, that's there's 2 photos. It's common sight in Taiwan's entrance of hospital is a long queue because we check every visitor of a hospital before they enter the hospital. And you can see the computer that's connected to the system. But this year, actually, we already, since we have quite a quick respond electronic manufacturer, they already have a product available. You can just insert your health smart card, and the webcam can measure the body temperature, and it can also detect whether the visitor wearing their face mask correctly. And of course, privacy and security is always an issue. But I just want to share that in Taiwan, we actually, by using the health information technology, we do have some result. Thank you.
Let me step in here, and Dr. Su, this is simply amazing. I had a question that you answered without even me asking it. When I was looking at the healthcare spends, Taiwan spends, if I'm not mistaken, about 5 to 6% of their GDP on healthcare. A third of what some of the other markets spend, and now I know why. You're still #1 with those spends. Yeah.
Unfortunately, actually, people are happy about the healthcare system in Taiwan, but unfortunately, health professionals, they are not. They are angry about the system. Here, somehow we can kind of rationing the healthcare resources by using this robust healthcare system. So there's debate. So I won't say it's good or it's bad. People are happy about the system. It's very difficult here to reduce any benefit from the people, but we do have very hardworking health professionals.
Thank you, Dr. Su.
I just wanted to find out from Professor Su as to how the country Taiwan is actually trying to improve quality and efficiency by using the digital health or health IT. What's the experience of you in this country, sir, in this regard?
Yes, I think medication safety is a challenge, especially in Taiwan, because here actually drug is just like free from the government. And so actually there is a term called polypharmacy. That means the patient took more drugs than he need. So actually here we use IT system. We do have many mechanisms to remind the doctor what kind of a drug already prescribed to the patient. Because fortunately, most of the Taiwanese are smart enough not to swallow all pills the doctor prescribed to them. Because actually is a problem here. Actually, since medical shopping or hospital shopping, because a visit go to a doctor is so cheap, so they go to different doctors maybe within the same day. So we use health IT to provide this kind of reminder for our doctors. And also, actually, in hospital, there is a very interesting case that we implement AI for chest X-ray. So in that hospital, actually, they use AI algorithm to detect any pneumothorax, any pneumoperitoneum, and any misposition of the incubated tube tip. So they don't send a message to doctor for trivial information, but they send information to their doctor immediately if the AI algorithm detect there is some severe problem on the chest X-ray. So I think it's a very efficient way to that AI to read the films before the radiologists do. And actually, there is also very interesting application of AI for chest X-ray, because here actually radiologists, they don't want to read X-ray because they get very little money for reading X-rays. So they just let AI to help them, and they just select the chest X-ray with a problem, and then they will, for example, in the morning, they will show this X-ray to the radiologist. Then they will arrange maybe normal X-ray in the afternoon that the radiologist to read them. So I think you can apply information technology to improve the efficiency, also improve the medical quality and the patient safety.
Dr. Su, I had a question, and this is for India, right? You both would be aware that we are in the process of building out our universal healthcare platform. We launched a very ambitious program which is underway. And last year we launched the National Digital Health Mission, which is the whole technology architecture, right? There are 3 or 4 big stakeholders, right, in this whole success of this program. There is, of course, the public health system. There is the private hospital and private practitioners. There is the patient, and then there is the allied health ecosystem. I would really, value your opinion here on what are 1 or 2 of the things that we need to probably look at to accelerate this build out, because we can't do it traditionally given the size and scale our country is and the time at which we are starting with so many variables. I know it's an open question, but it'll be very valuable to hear from both of you on any specific points here.
Maybe Taiwan's experience is not useful to other countries, because here actually we don't have real private hospital. here we still have maybe 74% of hospitals are so-called private hospital, but all hospitals are all contracted with national health insurance. So for people here, they don't have to distinguish between private hospital and the public hospital, because no matter what kind of hospital they go, they pay the same amount of money. So actually, about 10 years ago, Taiwan wanted to actually let all public hospitals release to private sector. The government, the health ministry, they don't want to operate a hospital anymore. But due to maybe 15 years ago, we have SARS outbreak. So after SARS outbreak, the Ministry of Health, they realized they still need to keep public hospital. So, but during the normal time, actually, public hospital just operated like a private hospital. They still need to serve patients to get their payroll. So, so actually, the only single pair is like kind of big boss. Actually, we don't have real interoperability issue. The only rule is that if you don't comply with the rule, the national health insurance they said, you won't get your money. So money talks. So I think you need to find incentive for provider or hospital to be willing to upload their data. So here, we are not just socialism, we are kind of communism in healthcare, so that's a problem.
Thank you for that. I have a question from one of our very well-renowned Vijay Agrawal sir. Question for Taiwan. So Professor Su, this is for you. Taiwan must have made benchmarks for outcomes of various procedures. Can these be shared? How do healthcare providers react to publishing outcomes if you do?
Of course, actually everything here is transparent. We trust that transparency is the best policy. We can publish all this result. Of course, some of the provider, they will be angry because it's not due to we have, for example, good national health insurance administration. We have this kind of result is due to we do have good health professionals. So I think that's something we always need to remind the government side. It's not about how good the government is, it's about how good the healthcare system is.
Thank you for that, sir. But I'm sure you must be publishing a few of these research articles of what are the outcomes of those benchmarks. So those benchmarks that you must have created, sir, were you able to publish them for the country, specifically for Taiwan maybe? So is there anything that you would want to comment on that, sir?
Yes. Actually, I believe health data research, just Ren has mentioned, is an important issue. Actually, we work with IQVIA international team. They support infrastructure called Odyssey. The name of Odyssey is Observational Health Data System and Informatics. Actually, it's about International Health Data Research Alliance. In that system, actually, we use a policy. We don't share data. We just share the algorithm. So we do our computing in our own hospital, our own institute, but we share the result. And actually, it's a little bit complicated process, but we can do that because right now in AI, there is a trend called federated learning. That means we don't have to share data because if we want to use data from other hospitals, sometimes is a challenge. And if we want to use cross-border health data, it will be even more difficult. So now we have solution for that. And actually it's a system supported by IQVIA and also Columbia University. And now there are more than 30 countries and 300 hospitals support this system. And here in Taiwan, we do use the identify anonymous data for data research. We researched those data to our researcher. So it's right now, actually, most of Taiwanese now accept that after restricted the identification process, actually, we can use the data safely, but actually it's a balance, the balance between privacy and utility. So I think it's a challenge, but I don't think we can do all this job without using health data research. I believe health data research, just Ren has mentioned, is an important issue. Actually, we work with IQVIA international team. They support infrastructure called Odyssey. The name of Odyssey is Observational Health Data System and Informatics. Actually, it's about International Health Data Research Alliance. In that system, actually, we use a policy. We don't share data. We just share the algorithm. So we do our computing in our own hospital, our own institute, but we share the result. And actually it's a little bit complicated process, but we can do that because right now in AI, there is a trend called federated learning. That means we don't have to share data because if we want to use data from other hospitals, sometimes is a challenge. And if we want to use cross-border health data, it will be even more difficult. So now we have solution for that. And actually it's a system supported by IQVIA and also Columbia University. And now there are more than 30 countries and 300 hospitals support this system. And here in Taiwan, we do use the identify anonymous data for data research. We research those data to our researcher. So it's right now, actually, most of Taiwanese now accept that after restricted the identification process, actually, we can use the data safely, but actually it's a balance, the balance between privacy and utility. So I think it's a challenge, but I don't think we can do all this job without using health data research.
Sure, sir. Thank you. Thank you so much for that information. Over to you, Amit.
Yeah. So this is a question again for both Professor Su and again, given the Indian environment, can you share with us examples of 2 innovations that you have in your countries that could be relevant for the Indian market to accelerate whatever we are trying to do?
Because actually, I think the size of a population of Taiwan is less than most of the province in India. So I think we face different challenges. But here, I think we trust that a robust IT infrastructure could let the operation of healthcare system more transparent, more efficient. So maybe, but I think you do have very good IT people, and so maybe you will find the ways for India, but unfortunately, I don't think because actually most of the country cannot use Taiwan's experience because actually it's for example, most of the people won't accept this kind of privacy policy. But here, since we just faced the SARS outbreak 15 years ago, actually people are quite happy if they can just share some of their health data but can get better health. They are willing to do that kind of things.
And I think we are at the end of this this panel. To me, I have taken away quite a few things, but the big thing I took away was the paradox between the happiness levels of various stakeholders and to be prepared for that as we move along, right? So have a great day, great evening. Thank you so much for joining us and sparing your time. Dr. Anil, it was a pleasure to co-host this with you, and thank you to CAHO to give us this opportunity to have this discussion.